real concern, this, if the R could be above 1. Was the government right to act so swiftly?
I mean, the government's absolutely right to take this very seriously and to increase measures and not ease lockdown further as of tomorrow. That's absolutely the right decision to make. In fact, we've been worried about this for a while because all the trends in the last couple of weeks have shown that the virus is increasing. The ONS figures haven't just come out today with new news. Last week, we were worried that the infection rate was increasing considerably from the week before. So this has been an emerging trend over the last 2 to 3 weeks. And the British Medical Association has been calling for the measures we've announced today to have been done at least a few weeks ago. And even now, we don't know why there's an 8-day delay to introduce the use of face coverings in all settings, because in all settings where you cannot socially distance, because every day that goes by is another day where the infection can spread further.
That's absolutely right. And I wonder if that is your only concern with the way the measures have been introduced, or if there are any other areas that are worrying you. Lots of people saying, look, if it's not safe for people to meet up indoors, how is it safe for them to be working indoors?
You're absolutely right. So what the most important thing for the public is to have very clear, simple messages that make sense in any setting. So, for example, if the virus, which we know is highly contagious when people are close by, and if you cannot socially distance and you're being asked to wear a face mask, it shouldn't matter whether you're in an underground train or whether you're in a shop or whether you're in an office. And what we've seen is sort of a drip feed of policy. First, it was only public transport. Then it was only shops. And then museums were not included. Cinemas weren't included. Offices, in fact, were not part of that program of face coverings. And also people who work in shops are told that they weren't required to wear face coverings. This is confusing. You need to have a simple policy, and also what social distancing means, because we moved from the clear message of being 2 meters apart to something called 1+, which I think most people, from what I understand, do not understand. Surveys have shown that the public don't really know what the correct social distance is. So we need to be clear that 2 meters means 2 meters wherever you are. And if you can't retain that distance, you should be wearing a face covering. And it doesn't matter whether you're a shop, whether you're a person working in a shop, or whether you're a customer. The same rule should apply to everyone. I think offices are particularly an issue, and other workplaces. We've seen an outbreak, I think only today, of about 50 odd workers in an Iceland store that have contracted coronavirus, because people are working close to each other. So I think there needs to be much more emphasis about the need for all staff to not only wear face coverings, but also in the workplace to have adaptations such as screens and barriers that can prevent infection. Now, that sort of measure in all workplaces we know isn't the case. I walked down the high street last night for my daily walked past restaurants where people were close to each other. There was they certainly were not 2 meters apart. And so it's no surprise in many ways we've seen the spread of infection. I think we need much more clear public messaging.
Well, that was going to be my next question. I mean, lots of people have been critical of the fact that this announcement was made by the government on Twitter at 9:15, with some of the measures being implemented from midnight, leaving lots of councils in the northwest of England scrambling to try and pull together their public messaging as well. And, of course, absolutely crucial that members of the public know what's going on if we're to beat the pandemic.
Absolutely. One thing that we've been calling for at the British Medical Association is for there to be daily updates, just like we used to have daily updates and briefings. We need those daily updates for the public, telling them about the level of infection in their areas. So what we saw today about a decision made, with 3 hours notice, really the population in those areas, such as Greater Manchester, should have been told, a while ago that the infection was spreading. Now, if we can provide that information, like we look at our local weather, if that information is provided on a daily basis, I think it would allow the public to be much more aware of the serious issues around infection spread. Because the infection is invisible, because the peak of the pandemic has passed, that doesn't mean the peak has gone. It hasn't. And as people begin to feel more complacent And as they are not as aware of the concerns around spread, what ends up happening is people do let down their guard. They are mixing more in bars, in pubs, in other settings, and so I think what's really important is that they are made aware regularly of the fact that this is an infection which is increasing in in the level of infection in the community. As I said, it's not something that just happened today. The figures have been, for the last couple of weeks, have been showing increases in spread. And if the public were aware of that 2 weeks ago, they may have been able to take more precautions, especially in those areas where we've now seen restrictions implemented.
And do you think it then is inevitable that we may well go back into a national lockdown at some point in the not too distant future?
Well, my advice and my hope really is that the government does absolutely everything to enable us to prevent a national lockdown. And the way you do that, because in fact, you don't need to be a scientist here. We know that the virus spreads by people being close to each other through droplets. So you don't need rocket science here to know that if we can put in place measures to prevent that happening, we won't see the infection spreading in a way to result in a second spike. But that does require consistency of message. It does apply, that does mean that if you have rules that are about social distancing and face coverings, they can't apply in one setting and not in another. It does mean that the public need to be given that message very regularly and very visibly. Just as we did with hand washing at the beginning of the pandemic, we need to resurrect that level of awareness. It does mean being clear about the fact that workplaces need to be supported to be making those adaptations. Most workplaces were never designed for people to work more than 2 meters apart. So it's no surprise when you are encouraging people to go back to work, people will end up being closer together than they should. And that requires considerable adaptations in terms of the numbers of people who go back to work, in terms of the adaptations such as creating barriers between individuals. It can't just happen overnight. So there needs to be, I think, much greater support and clarity about how employers need to play their part. A much greater awareness, as I said, for the public in general, that this is a virus that's increasing in prevalence, with that data provided at a local level. So I should know in my area, what is the trend? And if it's going up, I know that I'll be more careful. That's what needs to be done at this moment in time.
Dr. Chaand Nagpaul, the chair of the BMA, always good to hear from you. Thank you.